Hi everyone, I hope all of you are doing fine. Your SM has come back with a cup of coffee, so sit back for 10 minutes with me. And there is a very simple presentation on basic implant prosthodontic components. So I'll explain all those things in a while. So enjoy the presentation. Now, this is the display of all the components when it comes to implant prosthodontics. This is a simple display of many components. The first component what I want to show all of you is known as your healing abutment. The healing abutment is a component that is placed into the implant after the cover screw is removed from the implant. Suppose you have done implant placement, and if you have not placed a healing abutment in the first stage, you are supposed to place a cover screw and close the soft tissue. And once the patient comes back after 3 months for the second stage, you need to open up the soft tissue, you need to reshape the bone around the implant in such a way that the cover screw is exposed completely and the cover screw has to be removed. The next component that goes into the implant is known as healing abutment. So you need to select the height and width of the healing abutment according to the soft tissue that you have above the platform of the implant, and you can place the healing abutment accordingly. You can tell the company that I need this height of healing abutment and this width of healing abutment, and the company will supply you. You can also customize a healing abutment with composite. If you see in the picture, there is composite around the healing abutment. So you can always put composite around the healing abutment and customize it. Now, why do I need to customize? It depends on the area of the implant placement. Suppose I've placed an implant in the anterior zone, I can always place composite and shape up my emergence of the future restoration accordingly. If I want something for the molar, I can get a bigger emergence or a wider emergence by placing composite. So it is known as customization of the healing abutment with composite. But these days we are not customizing the healing abutments with composite. We are using the temporary abutments and placing the composite around so that we get a beautiful emergence for the future restoration. The second component which you can think about after the healing abutment is placed is your impression coping. Now, this is known as your impression coping. The impression coping goes into the implant after the soft tissue around the healing abutment is engineered or architectured. The impression coping has a hex. If you see here, the hex of the impression coping goes into the implant and engages in one certain orientation. So taking one X-ray after the impression coping is fixed into the implant with the help of the screw that I've shown just now, it's very important because we need to know whether the impression coping is sitting well into the implant. If I'm using multiple implants, let's say, then I can use a non-hex impression coping instead of hex impression coping in order to achieve the passivity of the transfer jig that I'm going to make for the open tray impression. It depends. I mean, you can take a call accordingly. If I'm using for a full arch case or a full mouth case where you have different orientations of the implants in the bone, then and angulations of the implants in the bone, then you can always choose non-hex impression copings for the same. This is known as analog. This is known as analog. You have two colors here. One is for the physical analog, for the open tray impression, where you can attach this analog to the impression coping and you can pour the impression with the die stone or the dental stone. This is known as digital analog. This is for the printed models. Once you place a scan body, which is your implant level scan body, into the implant, you can scan it up and the lab person uses this digital analog in the printed model, which is similar to the implant in the bone. And this is the scan body which you can place it into the implant. This is known as implant level scan body, which you can always place it into the implant and scan it up. If you see here, you have a flat surface. The flat surface can be oriented towards buccal or lingual, so that when the scan is done, the lab technician can visualize this in exocad, catch it up well, and then he can design the processes accordingly. There are schools of thoughts where they say that it is okay to use these flat surfaces proximal also when we fix it into the implants, but for an easier reproduction of the details, you can always use this flat surface, either buccal or lingual. So once the scan is sent, or once the open tray impression is done and the cast is poured out of it, you need to select the abutments. Now the abutments are of many types. To simplify it, you have stock abutment, you have UCLA abutment, you have milled abutment, and you have DMLS abutment. This much can be remembered as a basic when it comes to the abutment selection. Now what you are seeing here is a stock abutment. The stock abutment is by the company. So the company itself gives you the stock abutment. What you can do is you can fix the stock abutment on the master cast, which is poured out of the open tray impression, or the printed cast, which is there out of the scan, and you can make a prosthesis over it. One suggestion here is not to fix these stock abutments into the implants directly in the mouth, because you might have to mill them, or you might have to modify them with burrs intraorally, which might cause damage to the screw inside the implant, number one. And number two, it is not very easy to modify intraorally with all the soft tissues around, with the saliva, with the blood. So it's always better to modify it extraorally on the cast. The lab technician can do it, and the lab technician can prepare a crown over it. So usually with this explanation you can understand that a stock abutment is used primarily for a cement retained crown or a screw cement retained crown. Usually we cannot layer ceramic over the stock abutment, but now few companies are coming up with stock abutments where you can layer ceramic as well. UCL abutment is a plastic abutment which you get from different companies, and this is your UCL abutment which you have here. The UCL abutment will have a prefabricated base. If you see in the picture in the video, that you can see a prefabricated base there, and that's a cobalt chromium base or a titanium base which goes into the implant. The advantage is the prefabricated base will not get distorted when you do the casting procedure, and the plastic pattern which is there on the prefabricated base is converted into a casting. So this is usually made for a casted prosthesis. So when I use a UCLA abutment, you get casting over the prefabricated base, and after that you can layer with ceramic. So this can be used for a screw retained prosthesis. This can also be used for a cement retained and screw cement retained prosthesis. This is what we need to understand from UCLA abutment. When it comes to the milled and DMLS, what we have to understand is once we place the scan body into the implant and we scan it up, the printed cast what the lab person has will be utilized for either the milled or DMLS. It is lab part. It is not in our armamentarium when it comes to the milled or the DMLS or the printed, because from the scan everything is done. So they mill either cobalt chromium, they mill either zirconia or titanium or PEEK, or they print cobalt chromium in the form of DMLS. And you can either give a screw retained prosthesis, a cement retained prosthesis, or a screw cement retained prosthesis with the milled or DMLS abutments. So this is the basic thing which you have to understand when it comes to the implant level. So as a revision again, after the cover screw, you have healing abutment, you have impression coping or scan body, you have physical analog or a digital analog, you have a master cast in the form of a die cast or in the form of a printed cast, and then you can either use a stock abutment or UCLA or milled or DMLS abutments to prepare either screw retained restoration, cement retained, or screw cement retained restoration. This is all about the implant level. You have different companies for it, so you can choose the company you want, and you can keep 2-3 companies with you available so that you can cater according to the needs of the implant prosthodontics. Now coming to the next concept, which is known as multi-unit abutment level. These are known as multi-unit abutment, which you see in the video now. If you see here carefully, you have a carrier here or a positioner which will take the multi-unit abutment into the implant. The angulation of the multi-unit abutment here is different, and the way it goes into the implant is different. So it has 2 angulations here, one into the implant and one into the prosthetic platform. That's why it's called multi-unit abutment. It has 2 screw holes. one screw hole is for the prosthesis and one screw hole is for the screw which goes into the implant. This is an angulated multi-unit abutment. You get straight also at the same time. You can choose which one you want according to the implant placement that you've done. Please remember that the multi-unit abutments will have components separately. After the MUA is placed, the first component that goes into the MUA is known as your healing cap. So the healing cap goes and sits on the platform of the MUA, and this will help to engineer the soft tissue. The components are different here. This is known as your multi-unit abutment level impression coping or the multi-unit abutment level scan body. So you don't have a hex here. You have a flat surface which goes and sits on the platform of the MUA. So either the coping or the scan body. And these are known as universal scan bodies, which are used for many cases. These universal scan bodies can be utilized on any system with the prosthetic screw of that particular system, and you can scan it up. And this is only for MUA level. The analogs for MUA are different. If you see here, these are the analogs. Similarly, you will get digital analogs for the MUA level. Every component, when it comes to the MUA level, is different now. It is not something which goes and fits into the implant level now. So you should have two now, one implant level and one MUA level armamentarium in your implant practice. On the MUA level, usually we use multi-unit abutments only for 4 implants or more. Lesser than that, we usually do not prefer. It becomes a compromised case, and then we manage with occlusion. But when it comes to 4 or more, it is good to go for a multi-unit abutment prosthesis. So when I'm using 4 implants and 4 MUAs, multi-unit abutments, you get a framework usually. So the framework comes over the multi-unit abutments, which is layered with ceramic, or the framework on which the superstructure is luted on. So there are different frameworks and different layerings, different superstructures that you can go with. All that it is, it cannot be explained here, but the basic is you get a framework which can be layered with ceramic, or you can always use the framework on which the superstructure can be luted on. The different frameworks, cobalt chromium can be used as a framework, zirconia can be used as a framework, titanium can be used as a framework, PEEK can be used as a framework. So different frameworks are there. You can just go back and read about it, but understand that on MUA level, the prosthesis is a framework. It is not one single unit that is going to sit on. So all the MUA level prosthesis would be screw retained prosthesis on which the basic framework is screwed onto the MUA, and then you can either use layering in the form of ceramic or a superstructure that lutes over the framework. So this is all about it. I mean, I've explained all these basic components of implant prosthodontics. So as a revision again, when it comes to the MUA level, after the implant is placed, you can place multi-unit abutment. On that, healing cap can be placed. And after the soft tissue is engineered, you can go with either open tray multi-unit abutment level coping, impression coping, or scan body. And after that, you can verify the passivity with a verification jig. Jaw relations can be done. You can also do a PMMA trine in the form of visibility check, phonetic check, and occlusion check. And after that, you can go with a framework check, bisque trine, and final prosthesis with implant protected occlusion. So if you understand this much, then the implant prosthodontics becomes slightly easier to understand and then probably execute in your private practices. I hope you all enjoyed this presentation. I'll be back again with one more interesting topic. Stay tuned. Cheers.